Today we're going to be discussing the importance of PPE, personal protective equipment, in regards to patient eyewear. You can obtain more information from the OSHA website. This is something we also have to stay in compliance with, and PPE is one of them. So how do we decide what to wear and when? The OSHA website has a lot of information on that, and you can follow the link listed below. CDC, or Center for Disease Control and Prevention, also have their guidelines for infection control in the dental healthcare settings. This is scientific literature and evidence-based recommendations for PPE selection. They offer a lot of good information on masks, eyewear, protective clothing, etc. So go ahead and check out the website listed below here. So how do we decide what PPE to wear? One way to think of it is to decide what is within the 2 feet zone of your patient's mouth. So stop and think, okay, what is within this 2 foot zone of my patient's mouth? You might even take a tape measure and try to picture what is hit with the contaminated, often blood-containing spray and spatter. The spatter comes from everything we use during a procedure or cleaning or whatever. We're using an ultrasonic scaler, a prophy cup, a high-speed handpiece, air, water. All of these, if used, contain large droplets of blood-containing spray and spatter that will drop onto the surrounding surfaces within a 2 foot zone. So it's safe to say that everything from the top of the clinician's head to the hip area is within that 2 feet zone. The patient's eyes and the clinician's eyes are most definitely in the 2 foot working zone and require proper PPE. The image displayed on your left there shows you the 2 foot spray, splash, and spatter zone, and a direct hit of any generated spray and spatter should dictate the choice of PPE selected. The image displayed now shows the lack of PPE. If you can imagine, any of that direct spray or spatter will end up in yours and the patient's eyes. Addressing the issue. Sometimes a patient might present and wonder why they have to wear the eyewear. An easy way for you to address this would be easily, I'll have you slip these glasses on for me, as we have to have something shielding your eyes, and the patient might respond by saying, well, why do I have to wear these? Or I have never had to wear these before. An easy response would be, you know, Mrs. Jones, I know it seems silly, but many don't realize as we are working with very sharp instruments and handpieces. The water spray associated with our instruments contains some of the bacteria that's in your saliva, and it can be very harmful to the human eye. It's our legal responsibility to keep you safe from any harm. And easily they'll understand that. Go ahead and put them on, and they should be just fine. So our eyes are large mucous membranes that viruses can penetrate. OSHA requires that eyewear be able to protect the eyes from spray, splash, and spatter. This general wording allows for a variety of ways to comply with the bloodborne standards. So a lot of us have this eyewear available. It can come in different forms, like goggles, safety glasses, maybe the colored ones that are UV safe, full face shields, which aren't used a lot, but can be. Prescription glasses, as long as they have a solid side shield attached, and then prescription glasses with removable side shields. To decide which is best for you, you need to think of what will provide the best coverage to you and to your patient's eyes. The PPE selected should be comfortable, provide clear vision, and not put pressure or pinch to the head. The biggest thing is you want to keep the eyewear clean. It is very important to make sure safety glasses are cleaned thoroughly before donning upon each patient and in between each procedure. Many times a simple soap water solution works well, or rubbing alcohol. A lot of times, as you may know, even though they are clean, streaks and water spots will still be present. Wipe these off with a dry tissue or paper towel before handing them to the patient, because it will give the patient the perception that they are dirty if these water spots and streaks are not removed. And I know what you're thinking, but it won't happen to me. Well, it can happen, and that one time you don't follow precaution is exactly when it will. You will then run into the possible risk of a lawsuit and or loss of your dental professional license. This is something we have all worked very hard for, obtaining our professional license, and it can be easily taken away if we don't just follow the simple things that we know we should be doing. Most recently in Philadelphia, on the CBS local news, a mom went to raise awareness after her dental accident. She got some of the bacteria from the mouth in her eye and lost not all, but most of her vision. She just wanted to raise awareness that this is something that can be easily avoidable. Protect yours and your patient's eyes. Figure 13 shows a patient properly protected or clinician. You'll see the spray there, but it is being blocked from going to the eye and to the mouth. Figure 14 shows everything widely susceptible, especially the eyes.